Good morning, good afternoon, everybody, and welcome to the October 12th, 2023 agenda session for the Cumberland County Board of Commissioners. At this time, I will call on Commissioner Jones for the invocation and pledge of allegiance.
Heavenly Father, we just thank you for this day. We ask that everything will be done in decency and order. We thank you for your love and your grace, Lord Jesus. We ask that the choices and decisions that we make will be that to be of the better good for all those in our community. We also ask for a special prayer for those that are in time of war, that you may give them comfort over in Israel and all throughout our nation. Lord Jesus, we just thank you, and we ask that those that have already joined you in heaven will continue to embrace in your grace. And this we pray in Jesus' name, amen.
Amen.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Commissioner Jones. At this time, I will call on approval of the agenda. Manager Greer, are there any changes to the agenda?
Yes, I would like to make one change, Madam Chairwoman. I would like to move up the classification and compensation study to come right after the presentation by Dr. Green regarding the public health budget initiatives by public health.
Okay.
Madam, may I ask one question? We don't have a closed session, do we? Because some people may have to leave early. Just want to make sure.
Well, I do need a very brief closed session.
Okay.
Do it right now. We're gonna
Can we move that up after
The closed session.
after the comp study?
Yes.
Okay, and then we can have the closed session, then come back because of the other stuff.
Okay, if I can get a motion with said changes.
So moved.
So moved.
Is
Two
that-
changes.
It's been moved and properly second. All those in favor? Unanimous. Thank you. Manager Greer, if you would introduce the item and present.
Yeah, the first presentation, we have the public health budget initiatives where we presented by Dr. Jennifer Green. She's going to provide an update on the budget initiatives, maternal mortality, healthy conversations, and a couple other initiatives that we had in the prior fiscal year.
Thank you.
Good afternoon, Commissioners.
Good afternoon, Dr. Green.
A little show and tell, so I'll stick that over here. All right, so we have a few initiatives that thank you to you all funded in our last two budget cycles. I wanted to provide a brief update on our Uber project, our care coordination pilot project, maternal health, and healthy conversations. So we'll start with our Uber Health project. This was funded 2 budget cycles ago, and we have some outcome data for you. It was first implemented in August of 2022. The outcome data I have for you is from August 22 to 23, so 1 year. In that 1 year, we had 427 unduplicated patients utilize our Uber Health services that provide Uber transportation to the health department. It's a round-trip visit. They get to get picked up from their home or school or work and then brought to the health department and then back to their home or work. It allows them to go to all of our public health locations. Those 427 unduplicated patients accounted for 677 appointments, so folks use this multiple times. It's primarily used in for our maternity patients. About a third of those Uber rides have been for our pregnant persons, about 20% for our STD patients, and then also our clients that see Stedman Wade patients utilize the services as well.
Can I ask a question?
Yes.
Because you got that, did we, from that and from those appointments that unduplicated, were our no-shows reduced?
So we have
So
some.
I think that was one of the things we wanted to make sure was, because when you ride the bus, have to change, come, go back, so were our no-shows reduced?
Yes, so in particular for STD, we've seen a decrease in our no-show rate and an increase in our STD patients. So for example, in STD, we've seen almost a 10% increase in the number of patients that are coming to their visit. We have not seen our no-show rates come down as much as we'd like to because there are other barriers beyond transportation that we're continuing to address.
What's the funding source for this?
The commissioners put this in, you all put this in the budget for us 2 years ago.
We have a community transportation budget line item. Is that under that, or is it separate?
The problem sometimes with with that program, when you call it, is, and some of these are probably in the city too, but they will take you, drop you off, and then you have to wait to come back for a medical appointment. And that's probably, even with FAMPO, is part of the discussions that we have, is when you use that community transport, even if you go to Walmart, try to buy some ice cream, they drop you off, you get your ice cream, you try to wait for them to come back, and it sometimes go away. And so with this, is they would drop you off and may come back later to get you, and so people just wouldn't do the transport and just wouldn't come. So this, and our doctors would be sitting there waiting, and our nurses waiting for these patients to come, and we couldn't, we had a high no-show rate and all of that.
And the other benefit is
That's the problem.
this can do same-day appointments. So we can, if you call and say, I need to get picked up, we have an appointment, we have an opening for you in an hour, we can get you in an Uber, whereas with some of our other transportation programs, you need a little more lead time to do it.
Okay, so I want to follow up on that. Well, this seems like a better program than the other one. Can we divert some funding from the, it's doing the same things. We're doing drop-off and delivery of persons who need that service, right?
Well, some of that other one's federal funds and not our funds, so that's why we do this. But we are pushing at that particular in FAMPO to try to do Uber too. So I think they're moving toward that.
Can we put it under one budget line?
You have to talk to the manager on that one. That's above my pay grade.
It's okay.
Commissioner Bruce.
Thank you.
Houston, Mike.
Is this going to be by way of a request for quotes or anything on who's going to be Fred Uber, or is it whoever's next on the rotation? We just call Uber and they send it.
We call Uber, so we have our staff have a dashboard that they can put the request in, and then there are specific drivers that are able to do Uber Health transportation, and then those so not every driver is an Uber Health driver. There are particular drivers that have the extra training to get people in and out of the car, and that are trained to do Uber Health, and so there's a dashboard that we utilize for this. And the other piece is that so the same day piece has been a big benefit for folks that may not be able to plan ahead a little bit for this.
I wasn't laughing at your presentation there.
That's okay.
As soon as you said that, I just remembered my last Uber ride, and there's no way in the world that woman could have helped me out of the car. And so, yeah, if I'm going to a medical appointment, we now have 2 patients when we get there.
We don't want that. They have the, right, so every driver's, and one of the gaps still is that we utilize FAMPO is you can't get into an Uber by yourself if you're a teenager. So for example, our pregnant teens may need to get there. And so we still utilize and fill the gaps with other types of services. Or if you don't have a car seat, we can get you a car seat at the health department, but you still have to get to the health department. But you can't get in an Uber unless you're over the age of 18 by yourself.
Yeah.
Well, now you can.
Does that change?
Yeah, because I signed my son up.
Oh, there we go. You can, okay.
And somewhere on the internet, when I find it, I'll send it to y'all, but there's, similar to this, there's a county or a city that's doing it, and for safety reasons, what they're doing is they're having not just, when you get in the back of the Uber, there'll be a camera there, but that there's 1, 2, 3, whatever, 4 people, however long it takes, that do FaceTimes with the people for the transport to see if they go into distress. If the guy pulls over and decides, even though it's a rush appointment, he pulls over and goes and gets a burger. Not the patient, but the driver, or the driver starts diverting somewhere differently or something. They just do FaceTime, and then it seems to be based at wherever they're going. And you can watch a couple of different screens, and then literally, like you said, have our docs and nurses waiting for the person to get there and say, okay, Chairman Stewart's out front now, and we might want to bring in the driver with her too. So it was very cost effective. They had the figures with it, and it was very cost effective because before that, this particular jurisdiction was paying escorts.
Mike.
One more question.
Thank you, Madam Chair.
You're welcome. Ages 13 to 17 authorized now.
13 to 17,
With
parent
parent
consent.
authorization. Commissioner Jones.
Basically, I was just going to say that I commend you all for the program. Both are in need, though, because we have to always keep in mind for handicap, and of course, with the other program, they have accessibility for several of our underprivileged or individuals that have to ride by way of, that need accessibility for, in reference to wheelchairs and things like that, to where it's that would be the only disadvantage of when you're in a Uber. So we just have to keep that in mind, because some people actually have to ride in a wheelchair, of which the other service has, where they can actually ride in their wheelchair. So both, I feel, are beneficial. I don't know necessarily if we should start pulling money from that other program because of our handicap population. Let's keep that in mind.
Right, yes, these are not necessarily wheelchair access. Some of the vehicles, and we can request that type of thing, but you're correct about that.
Okay, Dr. Green, we won't ask any more questions until you're done.
But I like the questions. So the next initiative is our collaboration with Department of Social Services and Public Health. This is our Connected Care pilot project. The pilot project was funded in this past year's budget, really designed around addressing social determinants of health, preventing child abuse and neglect, improving health outcomes. And so we've hired a multidisciplinary team that is comprised of case managers, income maintenance workers, community social service associates, health educators, nutritionists, and a nurse. And that team provides case management and prevention services for families, as well as outreach activities. And so we get a referral, and that case manager, our two supervisors, can assign a team that fits the needs of that family. We formally launched this back in this past June of 2023. We've had 48 referrals for 36 individuals as of the end of September. 17 different agencies that referred to the program, everybody from our own internal departments to our friends and other social service agencies have referred to us as well. They've attended 23 different outreach events. They've got one going on right now in collaboration with Cumberland County EMS. The nurse is out there doing COVID shots and flu shots. You saw we're at Epicenter Church right now, so for the public that's listening, you can hop on over for another hour. And folks are giving out information about Medicaid expansion and other events coming up. And so doing mobile outreach events as well. Thanks to our friends at IS, they're working on a demographic dashboard and designing that for us. So we'll have that soon. The next project is our maternal health outcomes program. So this was funded in this year's budget. It's multiple parts to that. We have two media campaigns that work hand in hand. One is the Hear Her digital campaign, and so it is a model around from the Centers for Disease Control and Prevention, encouraging support partners and pregnant persons to hear the concerns of women when they have these urgent maternal warning signs. And so we've launched a digital media campaign. And in fact, yesterday when I was scrolling through my phone, sitting on the couch, I saw the ad pop up. And so you'll see ads like this that link back to more information about those urgent maternal warning signs. It'll come up on your phone. It'll come up on social media. We have an ad that will get streamed on Spotify and iHeartRadio. And we're working with Beasley Media on that campaign, and they'll also do some push out on the Beasley Media stations. In addition to that, we're working with our provider offices and then lots of other folks around town that do see postpartum women, not just the clinical settings, around educating about what those urgent maternal warning signs are. So we have just got these printed. They'll get posters like this in their offices that have show you what the urgent maternal warning signs are, and then we'll take you back to encourage you to call your doctor or go to the emergency room in certain instances. And so those are getting rolled out. We also will have magnets that will go to all of our postpartum individuals that come from the hospital or that we see in our OB offices or other places, our newborn home visitors. And we're doing this in collaboration with Cape Fear Valley Hospital and Partnership for Children, and then community care of the Lower Cape Fear. So making sure that we're all saying, all of our providers are saying the same message at the same time. The other piece of this initiative is training for our local agencies around what those urgent maternal warning signs are. So not just our doctors and our nurses, but our social workers at DSS, our newborn parent home visitors, agencies that see postpartum women, our WIC staff, on what those signs are, and so that they can look and recognize those signs as well. In addition to that, we are expanding our group prenatal care. We have a current cohort of group prenatal women in our group prenatal care class. We are expanding that. We are hiring for a community health worker and a provider that speaks Spanish, so we can offer the class directly in Spanish rather than having it translated. We are also relaunching our childbirth education class in November, so the next cohort of those families are coming up soon. They will get a gift card for coming, and then in addition, many of you are familiar with our Baby Bucks program at the health department. They will get Baby Bucks for participating, as well as an Uber ride to the class if they would like to do that. They'll also be given, the women that come on our clinic, they have the option to get a glucometer or a blood pressure cuff with a tracking log that goes along with it, so that they have those resources. So we tell you, watch out for high blood pressure, and then we're going to give you a blood pressure cuff so you can check that at home. And then finally, we're working with SHRAHAC on a conference for their annual, this will be their second annual OB-GYN conference. It's not just for OB-GYNs, it's also for our social workers, our case managers, other folks that work in the community health workers, and that will be in January 2023, and that'll be a combination of education and then practical practice in the Methodist Simulation Lab. And then finally, our last initiative is the Healthy Conversations Initiative. This is our newest project. We are going to be training barbers and hairstylists to be lay health educators, giving them the basic information that they know on some key health topics, including prostate cancer, and then also our salons. And then we'll be giving incentives to the shops and salons to participate as they see their clients into providing them education. They also are partnering with us to do outreach events, so providing haircuts during those outreach events, and utilizing our mobile unit, which was funded about 2 years ago, using that mobile unit to take it out for events like our Fun in the Sun event. The Barber Kings were out with us cutting hair during our Fun in the Sun event in September. We've got as I mentioned, our Connected Care program is doing an outreach event today. Haircuts are provided. They'll be out doing our Vax Yourself, Vax Your Pet event on November the 4th. We'll have free haircuts and to go along with that education. So we are in the process right now of hiring a health educator for that position, and hopefully we'll have that position start in the next 30 days. I think that's all I have, and if you have questions, I'm happy to answer them.
Any questions, Commissioner Jones?
I do have one question.
Yes.
Because going back to the maternal
Watch your
health.
glasses for you, Jay.
Oh, thank you. Going back to the maternal
Yes.
health, I did attend the town hall that they had.
Yes.
Just about a month ago. I noticed that some of the ladies, and I told them I would bring this up at the appropriate time, they wanted to know, is there any way, or is there any plans they have with lactation stations for when they breastfeed, pods in the workspaces? Do we already have any in place? And if not, it's something I plan on later, hopefully, having our council address.
Yes, so we have we have a health educator that is at the health department, separate from this project, but works that helps businesses become breastfeeding friendly businesses. And so they go out to businesses and help give them. We are able to fund a couple each year to become more breastfeeding friendly businesses. So we'll help them identify a space in their facility, and then give them the supplies that they need to make a breastfeeding room in their business. So it might be a couch and a little lamp, hand washing supplies, and help them to design that space, and then give them a little bit of a financial incentive in terms of the furniture to make the space friendly for breastfeeding people.
Or is there a list or any possibility where we, the county, can do that? Because I did notice several of the ladies there, they don't seem to, I guess, know where they are, or that was one of the needs when I was there, that they were stating that they would like to see Cumberland County have more
I don't know if we have pods out in the public set up, but that's something we can certainly go back and look at. I don't know that there's a list anywhere. I don't know the answer to that off the top of my head, but certainly we can we know which of the businesses are breastfeeding-friendly businesses, but in terms of like the pods you see at the airport, we do those at our staff sponsor at the fair. Our staff set up the breastfeeding space at the fair, and at certain events like that. But I don't know if there's a list of like outdoor pods for those, but that's something we can take back and do a little more research on.
Thank you so much, because they were mentioning, yes, like, the library and things like that. This is just what I took from the actual women here attending, so that might be something the county might want to, we might want to consider in our places of business, our place of business.
Yes, we'll take that back.
Commissioner Adams.
Yes. I just want to thank and commend Dr. Green, the Health Department, the staff, and in collaboration with Department of Social Services, the hospital. I think that these are the type of, and especially the commissioners for funding this, because prostate cancer and colon cancer is probably one of the most preventable cancers there are. And I think with the barbershops, the salons, we get right down to where they are to be able to have those conversations, because most people, when they, especially, I don't know about, I'm not going to talk for the women, talk for the men. When we get a barber, we stay with them until we die, or we go bald.
That's what I'm saying, that's true.
Or we go bald. So they know all of those things and can have those conversations. And this maternal health outcomes with Dr. Nestor Graham return, there are a number of pregnant women in our community that doesn't even see a doctor the second trimester. And I think that's one of the things that we're trying to address. And this gets there. I think we've got to talk to Cape Fear Valley and some of the other places to try to figure out what we're going to do to try to get some more OBGYNs into our community, because I think that's a push that we've got to work on. But I just want to say, I think that as we move in this is what we do for our community. So hats off, thank you, commissioners, for endorsing these programs. All of these were ones that this board did and saw the need for it. So thank you so very much for that, and all of those and staff for doing that. Thank you.
Thank you all, we appreciate it.
Thank you, Dr. Green. At this time, we're going to move on to our classification and compensation study. Manager Greer, if you will introduce the item and the staff to present.
Yes, we're going to go over the classification and compensation study. Dominique Hall will provide a presentation, and while it's being handed out, I will set the stage for this. Today we will present the recommendation for the classification and compensation study. Approximately over a year ago, the process of evaluating employee classifications and compensations due to the following: retention and recruitment issues, compression, turnover and vacancies, and employee morale. Today's presentation and recommendation will provide an overview of the classification and compensation study and request approval to move this agenda item to the October 16th regular board meeting for approval. Over the past year, we've met with employees, completed and adjusted job descriptions and classifications, performed market analysis, and slotted employees to their new classification, position, and/or grade based on interviews with McGrath Human Resources Group, department directors, and employees. With the fiscal year 2024 budget, the interim 4% early implementation cost of living adjustment was made to compensation. The recommendation today, if approved by you, will increase employee compensation an additional 7%, and due to moving everybody to the new market minimum, we are recommending a compression adjustment upwards to an additional 5.5% based on years of service. Depending on the department position and years of service, an employee could receive a total compensation adjustment up to approximately 12.5% more over the 4% that we approved back in July. So in total, originally I estimated it would be 10%, but in total, an employee can receive an adjustment up to 16.5%. This plan does not require any additional general fund dollars and funds the plan based on salary savings generated from turnover and vacancies that we're currently experiencing. Also, this plan will address and adjust the compensation for departments in which we're experiencing the highest turnover and vacancy rates due to less than competitive starting salaries. The plan will make the starting salaries for all departments competitive throughout our region and state, and we have a detail on that. To to evaluate the effectiveness of this plan during the remainder of fiscal year 2024. And as we formulate the upcoming budget for fiscal year 2025, we will not be recommending the following: any cost of living adjustment, reclassifications, and this plan will do away with all progression plans. Also, some employees that have already received an early, fully implemented compensation adjustment will not be included in this plan. However, we will, depending on the budgetary and audited financial results for fiscal year 2024 and the budget outlook for fiscal year 2025, may request a one-time compensation adjustment for all employees in fiscal year 2025. We plan to resume recommending compensation adjustments for fiscal year 2026, along with the revow, with your approval. And over the next month, if this plan is approved, we will communicate with all employees in the following manner. We'll send out communication via email and mail with the new salary information for each employee. We will go over this information again in detail with department directors at our October 27th Department Directors Leadership Retreat. And then we'll hold departmental meetings to answer any questions with employees. So we're going to go out to the employees and departments and answer any questions they have. And before we start the presentation, lastly, I'd like to thank all the employees, department directors for their patience with the process. We wanted to make sure we move quickly. We wanted to make sure we move correctly. And also, I would like to thank the McGrath Human Resources Group, Dominique Hall, Human Resources Director, Brian Haney, Assistant County Manager, Deborah Shaw, Budget and Evaluation Director, and Daphne Smith, Budget Analyst, for all their hard work in completing this process and the compensation study. After the presentation by Dominique, we'll answer any questions you may have.
Thank you. Good afternoon, Ms. Hall.
Good afternoon. Thank you, Mr. Greer, for the introduction, and good afternoon, Madam Chairwoman and Commissioners. Before I begin, I want to acknowledge that in addition to the county staff in this room, there are many others watching this meeting live. My goal is to keep this presentation as concise as possible, but I also understand this is a critical initiative for our organization. First, I want to briefly review some of the context that led to this study. The COVID-19 pandemic and the Great Resignation significantly changed the job market. Applicants and employees are seeking careers with higher salaries and a work-life balance. Cumberland County has also had a practice of hiring the majority of new hires at or close to the minimum salary for their position. We do not currently have a mechanism to move employees through their pay range over their career, and cost of living adjustments have not been consistent and not aligned with the market. All of this has combined to adversely impact our ability to attract and retain a skilled and motivated workforce. This has become part of our organizational culture and has had a significant impact on our ability to carry out our mission of providing quality services to our citizens while being fiscally responsible. The board has approved several initiatives over the past few years aimed at addressing our retention and recruitment issues. Those include more substantial cost of living adjustments, last year's retention incentives, additional incentives for sheriff's deputies and detention officers, and of course, providing funding for this compensation study. Our vacancy rate has hovered around 22% for the past couple years, climbing as high as 23% last June. It is currently just below 20%, while our employee count has also increased. This shows that the initiatives have shown progress and we're moving forward in a positive direction. Last year, we hired McGrath Human Resources Group to complete a compensation study for the county. And over the past year, they have helped us acquire the information needed to ensure our positions are properly classified and our employees are fairly compensated within the market. I want to thank our employees and department heads for their time, insight, and assistance completing and reviewing position questionnaires and attending the many meetings so we can make sure we fully understand their positions. What we ultimately wanted from this study was a compensation system and philosophy that will help us with recruiting and retaining a well-trained, experienced workforce so that we can provide the highest level and most efficient services possible for Cumberland County's residents. The study's recommendations increase our competitiveness in the market, simplify our compensation system, and eliminate inconsistent practices we've had to implement for critical, hard-to-fill positions, and consolidate our non-compensation/progression plans into two. The study looked at comparable organizations that were determined through meetings with our department heads, where they told us where their employees were leaving us for. We requested salary schedules and incumbent data from each organization and used the data provided to analyze the average market minimum, midpoint, and maximum rates for benchmark positions. Positions were placed in the recommended salary schedule based upon several criteria, including a market and compression analysis, internal equity, and a point factor system that evaluates positions based on a list of competencies obtained through position questionnaires completed by employees and reviewed by supervisors and department heads. The consultant used a comp ratio to analyze positions in relation to external market data. It revealed that almost 3/4 of benchmark positions were below the average market minimum, and approximately 90% of employees are below the average market rate. McGrath also analyzed our employee demographics. Our tenure analysis shows we are not retaining employees long-term. Succession planning is also a critical need, as more than 15% of our workforce is currently eligible for or nearing retirement eligibility. However, our tenure data shows a gap in employees staying long enough to plan for succession. So what do these recommendations look like? This slide shows market comparisons and minimum salary recommendations for some of our most critical positions: Deputy Sheriff, Social Worker 1, Paralegal, and Custodian. As a side note, the Office of State Human Resources has recently approved the Paralegal series with the addition of Paralegal 2 and 3. So that is incorporated here as well. The top row shows recommended starting salaries for each position with our current minimum salaries beneath, followed by some of the comps with the average of the comps in the bottom row. The recommended compensation plan puts all positions on a traditional grade table based on market comparisons and the other factors I've mentioned. The recommended grade table contains 40 pay grades with a general spread of 60% from minimum to maximum and 5% between pay grades. The first part of the recommendation involves making sure existing employees are on the new pay range for their position. Employees whose salaries are currently below the minimum of the new pay range had to be moved to the new minimum. In this step, anyone currently at or above the recommended minimum did not get an increase. The county budgets approximately $122.9 million in annual salaries for all positions. However, the cost of field positions is only $101.1 million. The total annual cost for this step is approximately $13.6 million, which is only $9.9 million when you take into account the field positions. If we stopped after this initial step, the result will be increased compression with even more employees grouped together at the new minimums, regardless of tenure, which would also inhibit our ability to recruit experienced employees. The second step of the recommendation addresses compression by rewarding our longest tenured employees and placing them further in the range of their pay grade. Depending on the employee's years of service, they will receive a compression adjustment between 1 and 5.5%. Because the majority of our employees do not have as many years of service, the total cost for this step is approximately $2.4 million. To illustrate what this may look like, I'm using an example of a paralegal 1 with 20 years of county service. Please note that this is not the case for every employee. This is an example using an imaginary employee. After reviewing the employee's duties and evaluating the position, it has been determined that the employee should be classified as a paralegal 3. The employee's salary would increase from $46,000 to the recommended minimum for paralegal 3. Then the employee would receive an additional 5.5% increase based on their 20 years of service, bringing their new salary to $66,917. With both of these steps, the total budget for annual salaries would increase to approximately $138.9 million, or a total of $113.4 million for currently filled positions. The annual cost of implementing the recommendation would be approximately $16 million, or a 13.1% increase to budgeted salaries. For currently filled positions, it will be a $12.3 million, or 12.2% increase. But again, that's for a full year. We will not incur this total cost until FY25. We're recommending implementation to be effective in the first paycheck of November. The cost of this partial year implementation will be approximately $10.5 million over the current budget, or an $8 million increase for filled positions. In conclusion, we believe implementation of this study's recommendations is more than an expenditure. It represents an investment in our people, the sustainability of our workforce, and the provision of services for our residents. But implementing this study is only a piece of the overall puzzle. There is more work to be done, and through the continued revision and refinement of our policies, creation of robust employee training and development programs, and construction of a sustainable workforce pipeline through internships and mentoring programs, our goal is to truly become an employer of choice in the region and state, and embody our slogan within our organization and in our community. Together we can. Thank you. Do you have any questions?
Thank you, Ms. Hall, for all the work that you've done. Awesome presentation. I'm sure we have lots of questions. Commissioner Booth.
Again, thank you for all the work on this. This has been not long overdue, but overdue. And, someone will say, well, I used to work over there in Latooga-Booga, and I was making this. We just kind of go like, is that true? Is that not true? And then we were comparing apples and oranges. Now we've at least got everything in the basket. We can see it. But the total package I'm very happy with. Concerns I have are a Cumberland County Sheriff's deputy who may get shot, maced, killed, stabbed, run over, anything, makes less than, and I'm in the legal profession. Someone that comes and works in an office. I mean, when there's a call out that there's a shooting, we've never had our paralegals jump in the car and go, try to, save rescue the people, anything like that call. That part, and also face-to-face, hand-to-hand. I know of families, I've lived here since 1969, I know of families that have been turned around by the quality of some of our social workers working with, and once somebody pretty much adopts the family, the Jones family, and I see that I help, and then, another family member and all, so, and I get that all straightened out, and that's less than the paralegal who is researching their pay raise. And so, it's not like I'm taking shots at doctors and I'm in the legal profession. I've never felt endangered when I did summer internships. I'm not fearful in my office and I've represented murderers, and I'm not fearful in my office of them doing anything. But some of those other people, you have people that are making life and lifestyle changes for people and families in the social work department, and protecting the social workers in law enforcement, and protecting the paralegals. So I mean, that's the only one I'm just kind of going, But again, thank you for this, because we've needed this sometime.
Any other questions, Commissioner Keith?
Yeah, I have a few questions. First, thanks for telling me all the employees are watching, so we don't know who to call, I guess. I need some clarification on one thing. A lot of your numbers were based around, and it feels like we kind of made the numbers work between filled positions and budgeted positions and what vacant positions. So what is the policy on vacant positions? Are we justifying this raise by eliminating all these vacant positions? Because you never went too deep into that.
No, we will not be eliminating those positions. we generate approximately, due to vacancies, approximately $23 million a year. So ideally, if we were able to fill all those positions, we would break even. So, right now, so we're not budgeting, we're not eliminating vacant positions, because that's part of the issue. We're trying to recruit people into the organization.
And I understand that, but last summer, we dedicated $8 million to employee bonuses that I questioned at that time whether that would have effect. Looks like it had a little bit of effect. But if we go on this trajectory, I guess the problem that frustrates me a little bit on this is we're only looking at money. Compensation is, money is the only thing that somebody's going to work here in Cumberland County for. They're going to leave as soon as they get more money. But we didn't talk about what the quality of life, the benefits. If we're not investing in the people, we're giving them money. And I didn't see anything in here that talks about making a better work environment, investing in them with education, because people will stay in a job that they feel like what they're doing makes a difference, they feel appreciated, that they like the work environment that they're in, their leaders feel like that their position warrants what they're doing. But there's nothing in this everything is just throw money at it and it'll be fine. And we tried that back in the bonus and it didn't work. And before you say anything, I believe that their compensation package needs to be adjusted, 100%. In the economy that we live in, we know inflation has gone up. But there's a recommendation right here, right now, for upwards of 27% for a paralegal 1 who gets moved to a paralegal 3. That's 27% increase because we've reclassified them and we've given them an additional cost of living over it. I don't know what the expectation is, but if we're not going to eliminate any positions, how is this sustainable?
Manager Greer.
It's sustainable because we will not be able to hire ourselves out of this. Right now, we're just trying to make sure that we're competitive with the other localities that we keep losing employees to. It's been hard to recruit social workers. It's been hard to recruit deputy sheriff. We lost 2 paralegals just a few days ago. This is just the beginning, getting the compensation right so we're competitive. So when we go out to apply, when we go out and advertise positions, we can hire people in and we're not losing people to Hoke or Sampson or Wake or Durham, anything like that, those counties. But this is just the beginning, getting the compensation right. After we evaluate this, probably more than not likely, for fiscal year 2026 with the revow, we go bring a package that encompasses all benefits also. There are things, other areas, other counties and local governments provide increased 401k contributions that we need to evaluate. Changes in the health insurance we need to evaluate. Other succession planning, internships, employee development and training. So we go look at everything and we go bring back another package. That's part of the reason why I said we're not going to have any cost of living adjustments. This is the cost of living adjustment. But if you approve this for fiscal year 2024 and 2025. And so we're going to look at everything and evaluate everything. If I had the chance to evaluate everything, benefits and salary and compensation, you're probably looking at a number close to $25–30 million. So in order to make it sustainable and right-size the salary so we don't lose and we stay competitive within the market as it currently stands, we want to get compensation right now. And then as we move forward, we'll adjust the benefits and bring a package back for the benefit package. So we also, once we get employees here, we keep them here. And it's not about salary. Because anybody, and it's been my experience, even if we gave, if somebody was going to leave for money, they're going to leave. But this right here, I think is a good start, especially with the departments that we're dealing with right here, sheriff and the sheriff department and DSS, that's where the critical need is. 80% of our vacancies are in those two departments. And so we're trying to galvanize that. Then on the back end, the state just gave us Medicaid expansion. So everybody's going to be fighting for the same pool of social workers soon. So we need to make sure that as Cumberland County, that we're not behind the 8 ball. One of the things I kept hearing from employees is that I can go here, less work and this, and they're going to pay me more. And that's the issue that we're having. So I feel the pain about the compensation. I do, trust me, I do. But we're in a different age where people are leaving for an extra dollar. But I think this keeps us competitive and less likely for people to leave. If I'm here and I'm getting a competitive salary and let's say Hornet offers me $500 more, I'm going to stay here because number one, our benefit package is better and I don't have to travel. And so those are the things that we're going to start evaluating and we'll bring forth in fiscal year 25 and 26.
Okay, if I could follow up. Do we know why the people left, the paralegals?
Salary. Money. It's money.
They said, I'm getting paid more.
I met with the paralegals a month ago, and they said that they gonna leave because they can go to another county, make more money, and do less work.
Okay, so less work and more money. You see that we're getting caught in a game of cat and mouse here, that if we raise our money, that if people are going to leave for money, they're going to leave for money.
But let me add this. One of the things that we provide a higher level of experience level here than the Hornets, and because of our complexity, and using Hornet, for example, in the Hopes. So people are less likely to leave here because they get a more enriching and more experience here. The reason why they're leaving is they're getting this experience and we're not valuing them with the compensation in hand. So if I'm not being valued with the compensation and I'm doing more, then why not I would leave and go somewhere else when I don't have the same responsibility and I'm going to make more money. I know it's counterintuitive, but if I'm getting paid, I'm more likely to stay and work somewhere where I'm getting more experience and will be more competitive, and then I don't have to move my family and leave.
What I heard from this presentation was financial compensation is the only thing that matters.
No, I think we've just been so behind over the past fiscal years and with lack of adjustments that we've fallen so behind that employees are leaving because of compensation. I'll
end it up with this. And to the point that I want to make this very clear, I believe that the compensation package needs to be adjusted, okay? But I'm just concerned that we're only looking at trying to fix a problem with money. So the follow-up, my last question is, how does this ever end? Because in the workforce right now, either we got to start doing things differently with whether it be technology or less. 2 years ago, we had 23% unemployment. Today, we have just under 20% unemployment. That tells me that some of those jobs still have not been filled in over two and a half years. So if we haven't filled them in 2.5 years, do we really need them? Or what are we doing to fill that gap?
I think, again, I think this is just the start. I think we'll develop a whole compensation package in which employees, and we'll right sizes as we move forward.
Yeah, well, all right.
Hold on.
You want to go?
I was just going to say, I'd rather pay less people more money than try to stretch it out, eliminate the position and say, let's take that position and increase the salaries of the people that have been doing the work for the last 2 years.
Commissioner Adams.
But, and I hear you, Commissioner Keith, but I'm gonna tell you, and I see I see our Department of Social Services director here. They will tell you the burnout with that, because the caseload, if you eliminate those, because we haven't been able to fill it, it's not fair to those that are there, because all they're doing is picking up that caseload. So you've got to be able to incentivize people to hire people to get that caseload down. When I think the manager's talking about people leaving because I can go somewhere else and have a smaller caseload, it's because they filled out their positions. So if we get these positions filled in the sheriff department and the DSS and you get less work. I might stay if I got a little bit less work, but I'm picking up my work and Mike's work because he just left, so we got to split that between me and you, and you can't give me any more payment.
I've been doing that for 2 years.
Oh, well, that's true. I know, you've been taking care of both of us. One of the questions I have is this, on our strategies, because we have this problem of, even if I apply here and I had 5 or 10 years worth of experience, y'all want to put me at the minimum. Are we going to take into account my experience, because that way we can steal them from these other counties. But anyway, but nobody was going to come here because I had to start at the minimum. So I didn't hear that in this, and it may be, but, so is that, I saw the 1 through 20, and that was somebody that was already here.
Right.
But if I'm coming from outside to here, you're not going to start me at that minimum?
No, that goes away. We're going to hire people based on their experience.
Okay.
And if they, and I think I mentioned this during the presentation with the attorneys, compensation, we get a superstar and they say, I don't want to hire this person, I want to hire him 5% above or 7.5% above, then we've been doing that already. So that's why it's not part of it, because we've already implemented that. I would like to add one other thing is that every budget cycle, we also evaluate all vacant positions. And so if a position is vacant for more than 2 years, it gets eliminated. So, yeah, and it has to be, the department director has to justify the critical need. We can't eliminate those positions in DSS because, again, the workload is so much. And then, again, we have metrics that we have to meet on a daily basis.
And I know that, to Commissioner Keith, in terms of talking to Ms. Hall, I do think that, and I was just talking to an employee the other day, benefits are important also. And so as we look at some of these strategies and we put that in there, I always believe that people who go out and go from a bachelor's degree to a master's degree to something else, that compensate, that ought to be in this. We ought to encourage folk to go get that training. So I'd like to see in those benefits that we've done that with UNCW and some of the other things, but more of that training so they can get that training to be able to be here. I believe retention is one of the strongest points, because we all know that when you bring somebody in, the training up front is one of the most expensive parts of all of this. And so if we can retain them, because I think that's why these other counties are doing this. And then the last thing I want to commend you all, because normally what counties do is look at counties of comparable size and try to figure out whether that's what we ought to pay. I like this study in terms of going to find out where our people been going to be able to see, because when you're talking about Durham and Wake, that's our competition in New Hanover. And because you can drive there within an hour, hour and a half, even down to Wilmington, and that's where the folk are going. I don't know, I see the hook in the harness, but if I'm gonna make $20,000 more, I can live here. I'll live in Godwin and drive to Wake County. So I think to commend you on that part.
Commissioner Jones.
I just want to commend you all as well, and I can say from experience, I used to be a case manager, not at DSS, but at mental health. What happens is, just as he was stating, you get burnout, number one, but a more important part is that if you go from a caseload of 60 to 200, realistically, the workers just can't keep up, so then the families suffer. It's not that, and then it comes back to our department. I see it all the time, like I said, from being a case manager, from being a counselor for mental health, so then you got a caseload of 200 people, you're doing the best you can do, but again, like he said, you have open, and then that's how we have cracks in the system, and then children suffer, but then when you have these lapses where people say, well, nobody got out to the house in time, because realistically, even the best case managers can only do but so much. And so that's what happens when these vacant positions happen. Then we see on the news that someone didn't get to someone's house on time. It wasn't necessarily that the case manager, or social worker, or mental health worker wasn't doing their job, but realistically, we got 200, 300 cases. I've been there, done that, and you're trying to get to as many houses as you want. So I commend you all, and this is definitely the right direction.
Let me let me add that, and I'm probably more in the lines with Commissioner Keith. I've been saying from the beginning, since I've been on the board, we have all these vacant positions, then take some of that money and put it somewhere. I understand that you can't do that with our crucial positions, because we have to be able to pay when we do get people in, number one, so I understand that, but there's some positions that, that we can eliminate, and you address that. And then as we move toward the recruitment part of it, this recruitment and retention, as we move toward the recruitment part, our people want an opportunity to advance. They don't want to start a job where they feel like they're already at the ceiling, there's no growth there. So along with what Commissioner Adams was saying, offer them more than just money, an opportunity for education, and we're working on the child care. So we need to really look at the totality of our benefits that are really outside of the money factor. It's cost us something, but we want to make sure that we address those type of incentives, as well as it relates to recruitment. We had this conversation about who we employ, who gets employed here, and Commissioner Adams and I were talking, we have a lot of positions for people to fill positions, and they have to have a driver's license, but their job doesn't require them to drive. Like, what's the purpose of that? People who have, as Charles Evans would say, missteps in life and have something on their record that was 20 years ago, but there has not been any infractions or anything since then, but because of the record and maybe the ability to not get it expunged, they are disqualified. And I think that if we really look at, and thank you, Ms. Hall, for assisting me with that information, but if we really look at what it takes to get a job done, a particular job, we need to start looking outside of the box and go after some of these people who might be part of the homeless community, who might be part of the community where they have, something on their record and not able to go, see Billy, Charles, or, Mitch to go ahead and get it expunged. We got to start getting creative and start looking outside the box to get some of these positions filled, to allow some other people to have a second chance at life, and to be able to allow them to participate in ways that they didn't think that they could participate. Commissioner Adams.
And this is my last thing. I will tell you, and Assistant Manager Schemes will tell you, because you brought it up and I forgot all about that, and I know Commissioner Keith too, because he's been hit with that, those benefits. So we're talking about this daycare. We've been approached by how many other entities? This is going to be one of those benefits that our people, our citizens, our employees get, because we've been inundated with requests from other folk who want to do that. And so I think those are first steps. And so I would encourage all of us as commissioners, if we think there's a benefit that we want to offer our employees, you got me, customers, employees, is to be able to send that to staff. So if there's something that we hear that we think is good, Ms. Hall's right there. She's been real receptive. She kicked me out of the office not long ago, said, leave me alone.
I'm sure.
Lastly, I was like,
They've all done it too.
for me, lastly, and that's why we have these future strategies up here, because we're going to start addressing these things monthly at the department director leadership meetings. And so succession planning, if someone leaves, we should already have a pipeline for someone to come into that position and shouldn't have to search outside for someone. Internships and mentoring programs, that's part of the issue. We can start mentoring and having internships with Fayetteville State, Methodist, and making sure, and some of the high schools, there's programs that we can start with the high schools where we get people trained, and we can start it, and we can develop them, and they go off to school, they come back, they want to be part of the organization. So the compensation is the first piece, but all of the rest of it is going to start coming through over the next couple of years. So we just wanted to make sure we started with the compensation.
Which I think is a great place to start. Commissioner Jones?
I was just going to say, also a good incentive, as we all know, everybody was working from home during COVID, and a lot of administrative positions, and also that allows for the pool of selection, a bigger selection. Many positions can be actually done remote. Of course, you want them to come in to the meetings, just as, we come to our meetings, but a lot of what we can do can be done at home. That's another consideration. I know with the COVID, there are a lot of different counties and states, since people were working at home anyway, they just allowed them to continue in that same area. So that's something to consider for an incentive as well.
Commissioner Adams?
I move that we approve the classification and compensation studies as presented by the manager.
Second.
And move it to the,
Consent, well, it depends on how the vote goes, but to the consent agenda, along with those future strategies to add benefits to it down the road.
and I believe Commissioner Booth second.
Yes, ma'am.
It's been moved and properly second. All those agree to move this to the consent agenda?
Unanimous?
Thank you. Thank you, Ms. Hall. Great
Thank
job.
you.
Great presentation. Now we will move on to our agenda items.
I think you wanted to go a closed session?
Oh, we're going to closed session? Okay. I would take a motion to go into closed session according to.
This will be for attorney-client discussion of two pending litigations.
I move to go into closed session for pending litigation matters pursuant to the statute.
Second.
It's been moved and properly second. All those in favor?
143-318A. That's unanimous.
Good afternoon and welcome back to the return of the Cumberland County Board of Commissioners meeting. We will now go down to the consideration of agenda items. And Manager Griff, you will introduce the item and the staff who will present.
Yes, the first item, the contract for design build transfer station at the Ann Street landfill. As you know, we're building a transfer station, and this is asking for approval of the contract. Amanda Bader, General Manager of Natural Resources, will present this item. She'll also present item B and C, on-site fuel supply contract with amendment for solid waste, and the former Cliffdale landfill participation will file with DEQ pre-regulatory landfill program. So she'll present A, B, and C.
Okay, before you start, I'm assuming everybody has looked at all of this?
Yes. They came to us in advance.
They came to us in advance. Anybody got any questions that you need? Anybody want to go through the presentation after looking at everything? Anybody want to do that?
Yeah.
No, everybody good? Okay, if I could get a
I move
motion.
to approve Phase 1 contract with TA Loving Incorporated and allow the chairwoman to execute the contract on behalf of the county.
It's been moved and properly second. All those in favor?
Unanimous.
Thank you.
It's not that we don't want to hear you, but when we get everything we need to know, you rung the bell. I mean, that's what I'm saying. That's just,
Yeah, approval.
no questions, no nothing.
Thank you.
That's a good thing.
Thank you.
You good? Okay. The on-site item B, which,
They only had one person who applied, who bid. I move to approve the contract amendment with Colonial Oil Industries Incorporated and allow the chairwoman to execute that contract on behalf of the county.
it's been moved and properly second. All those in favor?
Unanimous.
The former Cliffdale landfill participation in NCDEQ pre-regulatory landfill program. Do y'all need the presentation?
This one I did have a question, because this is the one that it wasn't a landfill to us, it was a container site for us, right?
Correct.
But it was an old landfill?
It's an old landfill. It's a pre-regulatory landfill.
Right.
They did a site visit in July. They were pleased with site conditions. That's DQ's subconsultant, and moved it to a priority list.
Right.
Good.
Okay.
Yeah, to make your, it was
That's-
your priority.
And it's no cost to the
Right.
county.
Madam Chair, I will move to approve the commencement of site investigation remedial action plan for the Cliffdale pre-regulatory landfill and allow the chairwoman to execute the attached consent agreements on behalf of the county. And I think I had a conversation with the manager, because the city of Fayetteville has something on about a landfill, but it does not include this.
No, it
This
does
is
not.
different. All right.
Second.
Okay. It's been moved and properly second. All those in favor?
Unanimous.
Item,
Now we move on to item D, electronic records and electronic signature policies. Manager Greer.
yes, Diane Pfeiffer with our ITS department will present this item. This is just an update to our electronic records and signature policy and modifying it. DSS has currently been using this policy for a while, so we're just kind of adopting what DSS has been using.
And I think through COVID, we've all gone to these electronic signatures. I got a bunch of them when I was with JCPC. I would move to approve the digital government recommendation approval of policy number 5.4, electronic signature policy, and number 5.3, electronic records and imaging policy, and request that these policies be placed on the consent agenda. And those last ones be placed on the consent agenda too, since they were for the September the 8th. No, that's not right.
For the 16th.
Yeah, but they got September the 18th on here, but to the next board meeting.
Okay, is there a second?
She second.
It's been moved and properly second. All those in favor?
Unanimous. Thank you.
Thank you, ma'am. We will move on to item E.
Okay. Yes, item E, resolution authorizing the increase in the federal micro purchase threshold certifying compliance. This is the most recent audit. Yvonne Mendez will go through this. This is to increase the micro purchase for federal requirements from $10,000 to, I think, $30,000 correctly? $30,000. And since we are a low-risk auditee, we can do this per federal statute, OMB compliance supplement, and she'll provide any answer any questions you may have.
And it looks as though the School of Government has already looked at this.
Yes.
I would move to approve the resolution authorizing increase to the federal micro purchase threshold and self-certified compliance of the most recent audit.
I have a question.
Okay.
Just ballpark, I don't need to know exactly, how often has this come up? I mean, what problem is this fixing?
Well, basically for federal requirements, the micro purchase was $10,000.
Right.
So that was that requirement. Now bumping to $30,000, you have some free way between the 10 to the 30s.
Okay.
And it's in compliance with the purchasing policy too.
Okay, all right.
Okay.
Thank you. Second.
Okay.
It's been moved and properly second. All those in favor?
Unanimous.
Thank you.
Item F is the infrastructure technology request for Medicaid expansion. As you're aware, the state approved Medicaid expansion. We have approximately $384,000 of technology requests and needs that we need to have prior to implementing Medicaid expansion. Brenda Jackson, DSS Director, is here to answer any questions you have. We have the funding for this from prior year grants that we've carried over.
I know that we have already looked at this, but for the benefit of knowledge, we're going to hear this presentation.
Why?
Because everybody needs to know.
This just to approve the utilization of the 269 and the 272.
Don't slide your motion in there. Go ahead. Go ahead. Ms. Jackson.
That's because you sit on this board.
No, I just think that this is important.
Yeah.
Not that anything else
How
wasn't.
about at the meeting?
Not that anything else wasn't important.
How about, she presented at the meeting?
She's going
That way,
to,
not only we'll get it.
it's going to be on the consent agenda.
Not if you move it to an item of business. You can move it to an item of business.
Move for a county presentation.
Can I chair the meeting? Can I chair the meeting?
Ask me.
Yeah.
I got it.
Okay, you don't have to hear it twice, so let's hear it now. And then.
No, it's on TV.
People can hear
Yeah,
It's on
Do I
TV.
vote against this or yes?
We on TV now. We on TV now.
No, more people look at it in the evening. They don't work today.
And the people that'll be there.
Go ahead, Ms. Jackson.
I'm gonna vote no, it's gonna go on anyway.
Good afternoon, Commissioners. Okay, good afternoon, Commissioners. Thank you for allowing us to bring this before you. As you know, Medicaid expansion and all the announcements through the state budget that it will kick off on December the 1st. That will expand about 600,000 individuals across North Carolina will be eligible for Medicaid. In Cumberland County, we're projecting somewhere between 35 and 40,000 individuals that may be eligible for Medicaid. When I talk about Medicaid expansion, I also have to talk about two other issues that fold into what we're doing as it relates to Medicaid. First is the continuous coverage unwinding, meaning that citizens that received Medicaid during the pandemic, certain policies and procedures were waived. For instance, individuals did not have to do an annual review. When an individual qualifies for Medicaid, they're required to do an annual review of their benefits and their eligibility. That was waived. And certain other criteria like able-bodied individuals. So you have an individual, say, that's homeless and doesn't work. They will only qualify for, say, 3 or 4 months of Medicaid, and then they would have to have work requirements. All of that was waived. So basically, for 3 years, any individual who was receiving Medicaid beginning around 2020 was able to continue to receive those Medicaid benefits up until the unwinding. And so the unwinding was decided to start on April of 2023, meaning that we had to pull those cases through a series of months. The state didn't mandate that we terminate everybody at one time. It was a continuous coverage process. This Medicaid expansion will help those individuals. Many of them now will qualify for Medicaid expansion. I had to bring that bad news to you back in January that these individuals may lose benefits, but with Medicaid expansion, it is believed that many of those individuals will now qualify for Medicaid beginning December the 1st. The other thing that happened is a lawsuit called Franklin versus Kinsley. That is a class action lawsuit around ensuring that citizens have the ability to contact Medicaid, to be able to leave a message about their Medicaid eligibility when it's time for their review. So really, we're really talking about 3 issues happening. You have Medicaid expansion, December the 1st, you have the continuous coverage unwinding, that piece of it, and then you have Franklin versus Kinsley. All of those are new Medicaid requirements. We are very pleased that the state allotted funding, CCU, what they call continuous coverage unwinding funding, to help us with kicking off Medicaid expansion. And in Cumberland, we received $269,609 in those CCU funds. We also received SNAP ARPA dollars, and Commissioners, you approved for us to be able to give incentive payment to eligibility staff and support staff out of that fund. Also in that budget was funding for technology to support the work that we do. We anticipate large volumes of citizens coming in. So to give you an example, we may have as much as 75,000 people over the life of this rollout coming in. Only about 50% may be eligible. So you're going to have folks that are going to come in that still under Medicaid expansion may not be eligible. So the 35 to 40,000 is what they project to be eligible. That is not the number that may actually come in and apply. So we average approving about 50% of the application. So we anticipate large volumes of individuals coming in. We currently do have a call center. That call center has been in place for 7 to 8 years. We were able to establish that within the resources that we have within DSS, and that call center is very strained. And we know that it is going to be a major burden on not only individuals coming into the building, but calling, emailing, and all of those things. And so we received those SNAP ARPA dollars that we didn't use. Those were in the amount of $272,000 we have remaining in that. We believe that a Medicaid call center will meet the needs of not only Medicaid expansion, but the Franklin versus Kinsley lawsuit as well, because again, citizens have to have the ability to reach us. And so we would like to create a Medicaid call center to help support the volume that we know that are going to come in. We also have had the pleasure of having other counties and looking at what they're doing in terms of their reception area, and a lot of counties have implemented kiosks to help with self-service, so a citizen can come in, go to a kiosk, register to see a worker, or even apply for their benefits and help us with the foot traffic that will come in from Medicaid expansion. So we're asking to use the CCU funds and the remaining SNAP ARPA funds to support building a Medicaid call center and establishing kiosks. And that will be for the computer technology, software, and all of the pieces that will go with building the infrastructure. We have been working with county management around Medicaid expansion and any staffing needs, and we'll be continuing to do that work to bring forth a proposal around staffing. And our request is consideration of this item, the use of the CCU funds and the SNAP ARPA funds for your October 6th consent agenda.
I request consideration of consent agenda items.
Well, can I do have a question for you.
I'm sorry.
Because, and I do like that, but let me ask this, on the kiosks, because we way down in Beaver Dam, we way out in Spring Lake, I heard you talk about the kiosks in the lobby, but are we going to put these throughout the county? And as we do this and do it through IT, I guess, is whether it can be, to help DSS and stuff, outfitted not just for Medicaid expansion, but to be able to maybe do some of these other things that need to be done, so that we use, like out in Spring Lake, I guess we either got the library or that resource center, whether we do them in libraries or wherever, when you're down in Beaver Dam and out in some of these other places getting downtown, I know our Uber money will be gone soon, as well as these kiosks, when we look at it, is this just enough to do that and need some added, and we can talk about it later, or whether to do these kiosks all around the county? Because if they can go in there and do the self-registration, it's a whole lot easier than having everybody show up at DSS.
So this initial request, because of the limited funds, is for the DSS facilities. We know we're going to get a lot of walk-in traffic there. It is certainly our hope to be able to expand to other outreach. Also, too, citizens can apply now through ePass. They do not have to come into the building. They can apply through the electronic system if they have the technology as well. But yes.
And that's the problem, I think, and Commissioner Keefe always talks about broadband and everything, is that and from the manager or whatever, and the assistant manager, is to bring us back a cost on that. This is for what you got, and I understand that, but I would like to see a cost for us to be able to expand these kiosks throughout the county to make it available to people who don't have that at home, who can't get on computer at home and do all of that. It's just much better if we have, and we can start off with a pilot as to what some of the far reaches up in the north, out to the south, out to Spring Lake, or you know the numbers. I mean, you can look at the numbers of where they're concentrated as to who's going to use it to be able to do that and do some of those kiosks. So, I mean, I think that there's some funds that we should be able to do that. Let's make this as easy as possible on some of these people.
One second, Manager Greer. Commissioner Booth.
The library just received several kiosks, and I'll see if we can integrate the software with those and have it as they've been strategically placed in the libraries throughout the county, and see if we can just use their kiosks. If not, then we'll come back with a calls for putting them in, across the county.
Commissioner Booth.
I was thinking very similar to that. Where do we have everywhere? But and I almost agree with Glenn, except for at the very end there, he caught on. You know where your people come, where they call home before they come to you for services. And if there's a fourth of them in a particular area, then we need to look in that area about getting the kiosk, rather than just put them and it be just as far, just as close for them to go to that as come down here. Because it's not going to eliminate your parking and your walk-in problem if it's just right over there at your building. I mean, they're not going to take up her time personally, but they're going to be parking and getting out and walking in your building to go to the kiosk beside her office. So.
Commissioner Keefe.
Thank you. Got a couple things. Brenda, I was going to vote against this because I thought you had a PowerPoint. But, I wanted, Medicaid expansion is such a big thing in our community. Nobody's going to remember what you said. And then with the reason I thought that if we put it to the evening meeting, at least the public could see it at a different thing. So, Glenn, to your point, I think you're right. I think we're being a little short-sighted at just looking at social services. There are so many things that the county does. Now, if you want to go down the path of kiosk, why can't you pay your tax bill on the kiosk? Why can't you book a public health department appointment at Stedman Wade or anywhere else? All of those things that happen. But more importantly than all of that, Brenda, I have to believe that most of your people have phones. Why isn't there an app for that? I mean, you can buy an airplane on eBay. You should be able to.
The federal stuff might have.
Fable Fix It, that you can go ahead and report something in. I have to believe that when you have the kiosk in your place, it's kind of like the self-checkout at Walmart. You still got to have somebody monitoring.
Yes, we do.
Because somebody's going to have to be there because somebody's going to get confused on how to do it.
That's correct. That's true. So, Commissioner Keefe, I have constantly pushed that our citizens, our population have exactly what you said in your hand, is a cell phone. And that's why we also push ePass. That is the state system. We don't have any control over that particular system, but it is a system, and it's a web-based system in which citizens can use their phone, and many do. But a lot of citizens also like to talk to a worker or see a worker. You will be surprised how many do like to come to, believe it or not, come to the office. But I think that it is our responsibility, and I agree, that we serve the customer how they want to be served. So if they want the kiosk in their community, we should have that. If they want a telephone, if they want an email, or if they want to see a person face-to-face, I think it is incumbent of us to be able to serve that citizen in the manner that they select to serve, whether it is an e-pass application, an email application, a telephone call, or face-to-face.
But that defeats the purpose of a kiosk, because you're not going to see somebody face-to-face. And at the same time, I know that we want to serve people at whatever level they have, but that should be more, I guess we'll go to their house if they ask for it. Okay, well, if we wonder why we don't have enough people.
Well, you make a good point, is as opposed to kiosks, because I heard you say face-to-face, is whether you can FaceTime on the computer at the library in a room, and they can just connect with somebody from DSS.
No, but the state does not allow.
Right, they don't allow some of that stuff.
And the people
that we cannot do.
Right.
The people that would be using the kiosk are not the same people that want to sit face-to-face.
Right.
That's a different group of people.
But they would have one of these too.
Yes, but there are some people.
He said do the app and the kiosk.
Yeah, but I'm just saying, there still will be a need for kiosks and the face-to-face, because there's some people who, some of our elderly community, and I mean, Mike and Glenn are getting older, and so they're gonna forget how to get their house.
Tony. Okay, then, you get on an airplane. You get on an airplane with this.
Absolutely. What I'm saying is that there is a people who would rather sit face to face, and those are the different people that will get on the phone to get a ticket or a stop.
It's just like Walmart. So you have Walmart that has self-service, but they still have people at the register. People tend to select. I know, but people select even though there is some select to go to the self-service, and even if they need help, they still select to go there. But some select to go to see a person face-to-face. So it's about that type of service delivery.
It's going to do an app for that too.
Manager Greer had something to say.
We'll soon have a county app that will be doing all the things you just said.
That would
be amazing. He's been asking for that
forever.
So yes, we are.
When he was on the city council.
So we're very close with that. Just wanted to let you all know that we're close with that, and that's part of one of the things that we plan to have in the app.
Thank you. Commissioner Jones.
I request consideration of consent agenda item be moved for our regular meeting on October 16th, 2023. Approval to utilize $269,609 CCU and $272,000 SNAP ARPA funding to purchase computers, hardware, software, equipment, and accessories to create a Medicaid call center and purchase registration, self-service kiosks to make the infrastructure demands and stringent telephone responses, time of Medicaid expansion, PHE unwinding, and Franklin versus Kinsley class action lawsuit.
Is there a second? All those in favor? All those in favor? It's 270.
Voting in favor, Commissioner Jones, Commissioner Stewart, Commissioner Adams, and Commissioner
Well, we
Booth.
can have her present.
Voting in opposition.
Just do it as unanimous and then move it as an
I'll
item.
move it to an item out. Ms. Jackson, if you could come back with a PowerPoint presentation.
Just come back. People need to see.
If you could come back on a with a PowerPoint presentation on October the 16th to line this out. Okay.
For an item of business.
We are, yes, but we're all in unanimous, right?
If you make it an item of business, yes.
It is an item of business, okay.
Thank you all very much.
He wants to see it.
I've heard about Medicaid expansion for 12 years.
Okay, so
We're going to have it here, people need to know about it.
But what I'm saying is, do you want her to do something on Medicaid expansion? Because this is just a contract.
Yeah.
So if you want something on Medicaid expansion, I think we need a presentation.
But the purpose is she can tell how we are getting prepared for Medicaid expansion, which is happening next month.
Either way. Just, I mean, she needs to know what she needs to present further than that, so that's good.
He said so the people will know there'll be
Right,
chaos.
that's right.
So they'll know they have
She knows what people want. That's what everything is.
Manager Greer, we will now move on to okay, y'all.
That's over there, Madam Chair.
We'll now move on to item G.
Item G is addendum to the lease with Cumberland County Communicare. And also, item H is closure of the portion of SR 4089 King Road. County Attorney Rick Moorfield will handle both of these items.
Okay, the first one is just an addendum.
To the existing lease at the same rental rate of Communicare. It's the space up at 109 Bradford Place.
Okay, Commissioner Adams.
You got, okay.
I make the recommendation that we make the amendment to the lease. The board may adopt the following resolution. May be resolved as follows. Cumberland County Board of Commissioners finds that a certain real property consisting of 3 office spaces containing approximately 500 square feet located at 109 Bradford Avenue will not be needed for government purpose before June 30th, 2014, and that the board...
2024.
I'm sorry, thank you. June 30th, 2024. And the board further finds the best use of this space is to add it to the existing lease for the Cumberland County Communicare Corporation for a term of 1 year to expire with the exceeding lease in accordance with the lease amendment attached to and incorporated within the resolution. And the board hereby approves this lease and authorizes the county manager to sign for the county.
Is there a second?
Second.
It's been moved and properly second. All those in favor?
Unanimous.
Okay, the closing on King Road?
This is just a portion of King Road. It has already been removed from the state maintenance system by the DOT, and that documentation is in there. The 3 property owners that own 6 parcels there are requesting this closure. It is, this property is out next to Jack Brett High School. All these property owners have their property under contract with a developer for commercial development there. All the documentation is attached. Determined that it complies with statute for the board to make this closure, and recommend that you can do so by just adopting the resolution that would be on the October 16th. This thing is setting up for your public hearing on November 6th so that it will be time to do the 3 advertisements that are required. This is just the first step in which you will adopt this resolution of intent and direct it to be advertised, and that's what you'll do October 16th for the public hearing to be held on November 6th.
Okay, if I can get a motion. Is there a second?
I was just looking at the resolution. I recommend that the board adopt the attached resolution of intent to make this closure, set a public hearing on this matter for November the 6th, 2023, and I'm going to put this in here, Rick, that we send direct publication or direct notice to Hope Mills, because it's right next to them, to the town of Hope Mills, to their manager, so that they will know that this is there, because they may not read it in whatever it is, the paper, is it paper?
Yeah, I'll second that.
It's been moved and properly second. All those in favor?
Unanimous.
Okay, thank you. And our monthly reports, we have all seen those. Are there any questions about any reports? I will entertain a motion to adjourn.
Second.
No, I need a motion.
So moved, that we adjourn.
All those in favor?
Unanimous.